Hi everyone and welcome back, and also welcome to the new subscribers as well. I thought today we'll have a little chat about weakness in the core, or abdominals as we call it, and also if you've had issues with the lower back. I work with a lot of people that have had spinal surgeries, spinal injuries, and also surgeries in the abdomen, so it creates that weakness in the core. So I thought we'll have a little chat about how we can strengthen it and stabilize it and help you on your way to recovery. So usually weakness in the core we call gluteal muscles, so buttocks. We've got transverse abdominis that works as a corset, and then we've got oblique muscles and rectus abdominis. I mean, there are plenty of other muscles, of course. However, we're going to look at how we can stabilize the pelvis and strengthen the muscles around it to support your lower back or abdomen if you've had any surgeries in the abdomen. So follow along, and then I will guide you through how to set yourself up for the exercise. All you will need today is a little cushion just to support your head and neck. Either a little cushion, I've got a little block, yoga block, and a yoga ball as well, if you would like to use one, or if you don't have one, you can use a little towel in between your knees, and of course some water to guide you along, because hydration is very important for our spinal health and our well-being as well. First things first, set yourself up on the floor. Make sure you've got a mat or you've got a comfortable position where you can lay and relax. Get a little cushion ready and then lay back down. And then we'll find a nice neutral position. So you're looking at the slight chin tuck, so your neck is nice and long. Shoulders are relaxed, so they're not hiked up by your shoulders or too far down. Make sure you've got your shoulder blades, or the scapula as we call it, nice and relaxed, hands by your sides. And then we need to find a nice neutral position on the pelvis and the lumbar spine. So you're going to tuck your tailbone under and then back, and then under, and then back down. And then make sure when you relax, you find that neutral where you're comfortable, so the spine is not flat into the ground. And then we're looking at the rib cage, nice and relaxed, so it's not flaring up. So from here, I would like for you to assess and see, when you lift your leg up, if your pelvis is shifting to one side, then that's just going to show that there is going to be a weakness in your gluteal area, and also that there is instability in the pelvis. So for example, if you lift and the pelvis stays nice and stable, then you're using all the correct muscles. But if you're lifting your leg up and the pelvis is shifting one way, and then you're lifting the other leg and the pelvis is shifting the other way, that means we're looking at working on stability and strength in the core muscles. So let's assess yourselves and then come back to me, and we're going to start exercising. So once we're in that position of nice neutral, what I would like for you to do is focus on engaging your abdominal muscles. So it's as if you're going to cough or sneeze. So you're tensing up through the abdominal muscles, but make sure you're not pushing the pelvis down or the lumbar spine down into the ground. So when you engage, nothing else should be moving. If you need to, you can put your hands on the bony parts of your hips, and then you should feel the abdominal muscles engage. So once you're in there, in that position, and you've engaged them, what I'd like for you to do is start gliding one leg down straight on the ground, and then bring it back up. Bring it back, and then you're going to focus on moving it all the way down and then back up. So this exercise is good for stabilizing the pelvis and getting you to engage the abdominal muscles. This is going to support your lumbar spine, so lower back, if you're having issues with the lower back. And that's not going to create that compression down on the discs. So I would like for you to repeat this for a minute. I prefer to do minutes timing rather than repetition, so you're not over focused on counting. I would like for you to focus on what you're feeling. So do a minute of those and then come back to me. So from here, once you've done a minute, we're going to come back and we can increase the intensity a little bit by bringing your heels slightly closer to your bottom. And then we're going to do knee raises. So you're going to bring it up to 90 degrees, toes pointed, and then lower it back down, and then up, and then back down. So what we're looking to do in the future is getting you engaged in your core, lifting both knees up, and then you're going to be tapping one, and then bringing it back down, and then tapping the other, bringing it back down. However, if you're struggling with the lower back issues, or if you had abdominal surgeries, or if you've just had a child or baby, so you're not going to have that stability. So what we're working on here is improving the stability and strength so you can continue into that strength training exercise. So let's start with that. So once again, you set yourself up in that neutral position, put your hands on the bony prominences here, engage your abdominals, make sure your spine is nice and neutral. And then from there, you're going to breathe out and lift, point your toe, come up to 90 degrees and then lower it back down. And then you swap and then lower it back down. If you're ready, we can start increasing the speed slightly, but make sure you focus on getting those muscles engaged rather than speed. So if you lose the connectivity, lower back down, reset yourself up, and then start again. So I would like for you to do another minute of those. Let's see how you get on. Okay, so let's go through the gluteal activations. So glute bridges or shoulder raisers, however you'd like to call them. So I would like for you to start with your heels slightly closer to your bottom, so you're actually activating more of the glutes rather than the hamstrings. We don't want the hamstrings kicking in too much. And then hands and knees by your side, nice and relaxed. And then you can start rolling up by squashing your lower back into the ground. So rolling up bit by bit by bit by bit by bit, only up to the rib cage. If you feel like the rib cage is coming up, you're going too far. So you go up there and then you slowly roll back down. Good. And then you roll back up, so slowly bit by bit by bit by bit. And then you lower back down. So you're going to do 5 of those. Once you get to 5, then you can roll up. Make sure your abdominals are nice and activated. What you can do is lift the leg up and then lower back down and then lower down again. If you're feeling like your pelvis is shifting when you're up in the glute bridge or you're lifting the leg up, what you can do is bring your ball in, put it in between your knees, and then you're going to come back up. That's going to give you that stability in the pelvis. Once you're there, you can raise the leg up and then you lower it down and roll down, and then you roll back up, lift the other leg up and then lower it down and roll down bit by bit, so vertebra by vertebra. However, if you've got osteoporosis or osteopenia, it's really important that you don't roll up vertebra by vertebra. What I would like for you to do is actually come up in one block, but you're only lifting up to the rib cage. So you're going to engage the glutes and then come up to the top, hold it there, and then you lower down. And then you come up and then you lower down. So it's actually one block rather than vertebra by vertebra. And then again, so when you're at the top, you're squeezing your glutes and abdominals, and then you raise it up and then back down and lower down. So it's a little bit faster than rolling up bit by bit. Give it a go. So we're doing a minute of each, 5 of roll-ups, 5 of roll-ups with the leg up, and then you're going to repeat again, but you're going to go a little bit faster as a one unit, activating a different gluteal muscle. So one more exercise we're going to do is stabilizing the rib cage. So the rib cage is connected to the pelvis through the rectus abdominis, obliques, transverse abdominis, like we've discussed. So what I would like for you to do is see whether when you get your arms over the head, whether your rib cage flares up and your spine is arching. That means your lower back is going to be doing all the work and the abdominals completely switch off. So to assess, you're going to go overhead, feel where the rib cage starts flaring. That's where you stop, and then you come back to center. And this is going to turn into your exercise. So you're going to raise it up until you feel it, and then you come back to center. You're going to start feeling rectus abdominis kicking in. So make sure it's nice and stable. The pelvis is nice and heavy and central on the floor. Once you've done a minute of those, what you can do to progress is get your yoga block, put it in between your knees. So you've got a light squeeze on the yoga block, get the ball or a towel, hold it in front of you, light squeeze on the ball, and then you're going to lower it back down until you feel the rib cage flaring, and then you bring it back up. And here you're going to start feeling more of the core activation of the abdominal muscles and stability through the lower back. And I would like for you to do a minute of this. Good luck. So now you've done these exercises, I would recommend doing them every day to make sure the core is activating, the glutes are firing. And then next time I come back to you, we can do some exercises to start getting you stronger, and then you can progress to harder levels. Give them a go. It's lovely to see you all. See you soon.